Hi, and thank you for joining us this morning. Although the last week it has still felt like summer, flu season is right around the corner. Last year, the flu season was widespread in Minnesota, and for an extended period of time, the Center for Disease Control reports that nationally, nearly 180 children died from flu complications, and about 80% of those children did not have the flu vaccine. Joining us to talk about the flu vaccine and influenza is Dr. Jill Amsberry. She's a pediatrician at CentraCare Health Pediatrics Department. Thank you so much for joining us.
Thank you for having me.
So the first question is, why is the flu vaccine recommended?
Well, as you discussed, the flu vaccine is a serious disease. So we know in any given season that it can cause infections in millions of people. It can cause hospitalizations in hundreds of thousands of people. And in any season, thousands to tens of thousands of children actually die, or of people die each year, and many of those are children because they're some of our most at-risk patients.
So who should be vaccinated?
So we recommend vaccination for anyone ages 6 months and older. It's particularly important in certain populations, like children less than 5 are more at risk, people over 65 years of age are more at risk, those with underlying lung diseases such as asthma, other chronic lung issues, or those with immunodeficiencies, so like kids with cancer and other populations.
When should we receive the vaccination?
That's a good question. So we typically want people to have received the vaccination by the end of October. The vaccine takes about 2 weeks to develop immunity. And so we know that the most common time for flu season is end of October through kind of the spring, with the peak being January, February. That being said, we're happy to have people get the flu vaccine anytime during that season, but the general recommendation is that they receive the vaccination by the end of October. Now, go ahead.
There was some news this year that AAP was really recommending that you go and children get it vaccinated early. Is that correct?
Yeah, and the other reason for early vaccination is that some children actually need 2 vaccines. And so for those kids, once they get the first vaccine, they actually don't have immunity. And so we want them to get in as soon as possible to get their second vaccine before flu season begins.
Can you explain a little bit about what herd immunity is?
Yeah, herd immunity or community immunity is a really interesting concept. So we know that germs spread easily from person to person. And if a germ spreads too quickly, it can infect lots of people in a very short period of time, causing what we call an outbreak. If you have vaccination to certain diseases, you can decrease that spread. So with influenza, the more people that have received their flu vaccine, the more that herd immunity protects the community. So that the disease, even if it infects one person, it can't spread as quickly to other members of the community. That's really important because there are members of our community who actually can't receive the vaccine, like young infants, some people who are immunocompromised, kids with cancer, things like that.
So by getting the flu shot, you're not only protecting yourself, but you could potentially be protecting other people.
Absolutely.
Okay. Is the flu vaccine safe?
Yes, the flu vaccine is very safe, and it gets studied every year as the vaccine changes. They're constantly studying it. In the last 50 years, hundreds of millions of vaccine have been given, and we've found that it's very safe. There are 2 safety reporting mechanisms that we use in the country to monitor vaccine safety. One of those is called the Vaccine Adverse Event Reporting System. Anybody can report to that if they feel like they've had a vaccine reaction. And there's also another reporting system called the Vaccine Data Safety Link, and that is a collaboration between the CDC and multiple different hospitals, and they're monitoring vaccine safety that way as well.
Okay. Well, we do have a question that came up on Facebook, and the question is, have they changed the vaccine to cover more strains of the influenza? Does the vaccine change every year?
That's a great question. So So it has changed over the course of many years. So there was a time where they only covered one strain or two strains. Now it covers 4 strains. If you get the quadrivalent vaccine, you're covering 4 strains. If you receive the trivalent vaccine, you're covering 3 strains. The flu disease itself does change every year, and there's multiple strains that we're kind of looking to protect against every year.
What about the flu mist? Is that a good alternative to the shot?
That's a great question. So the flu mist is kind of a longer story this season. So flu mist has been around for a long time, and what we found was that flu mist from 2010 to 2017 wasn't as good at protecting against one specific strain, H1N1. It was still really as effective as the shot at protecting against influenza B and the other strain, H3N2, but not really that effective against protecting against H1N1. And so last year, the flu mist was not recommended at all. This year, however, the manufacturers have added some components and changed the H1N1 portion. So the belief is that the flu mist will be as effective as the shot itself. We just don't have a lot of data on that. So the American Academy of Pediatrics is saying to use the flu mist as a last resort, where the CDC actually recommends no preference. They feel like it's going to be good enough. Here at CentraCare, we won't have the flu mist available, and there's a couple of reasons for that. One of those is what I just talked about, that being that, we really still don't have a lot of data on the new flu mist. The other reason was just supply. There was some questions about whether there would be adequate supply for our entire community and for the state. And so there was, the decision was made to not provide the flu mist here. You still will likely be able to get the flu mist in other places if you wish, but make sure that you're not one of those people who actually doesn't qualify for flu mist. There are certain populations where it's not recommended, like children less than 2.
Okay. Wow. Very good information.
Sorry.
No, that's great. Can my child or I get the flu when we get the flu vaccine?
No. And so there's a few reasons for that. So I'm just going to touch briefly on what the vaccine actually is. So there's 2 types of injectable vaccine. The first type is an inactivated type. So they take the virus and they actually inactivate it. So you can't get the flu from an inactivated virus. The second injectable vaccine is something called the recombinant vaccine, and that means that there's actually no flu virus at all in the vaccination. And even from the flu mist, which is something called a live attenuated virus or vaccine, what they do is they take the virus and they weaken it. That virus can only replicate in cold areas. And so when you get the spray in the nose, it can replicate in the nose, but it can't replicate anywhere else in the body. So it can't get into your lungs or anywhere else. So both the injectable and the flu mist can't give you the disease. We do know that they've done a study and given people the injectable vaccine, and they've given people salt water. And what they found was that the injectable vaccine did cause a little bit more redness and soreness around that site of the injection. But other than that, there was no difference in side effects. So the number of people who reported fever, headaches, cough was the same. So.
Okay, well, you answered my question. I was going to ask, are there any side effects from the vaccine?
Yeah, so the main side effects that we see are the ones that I talked about. So just really localized swelling, a little bit of redness and soreness. Some people can get fever, but some people can also get headaches. Some people will also get some nausea, but typically the symptoms are very mild and just last a few days and go away.
Now, you said that there are some children that do need 2 doses of the vaccine. Can you explain that to me?
Yeah, so the first time you get the vaccination, it's sort of like you're priming your immune system. And the second time you get the vaccination, you actually develop the immunity. So for kids less than 8, if they've only received one influenza vaccine, we do recommend that they get 2 vaccinations so that they can really make sure that they have the immunity that they need. So for example, a child of 6 months of age who's never received the flu vaccine, we want that child as soon as they're 6 months to get their vaccination, and then their booster, which is at least 28 days after the first dose.
Okay. So my last question is, knowing that you're a pediatrician, what are some comfort measures that you would recommend with a child that might be anxious, might be scared when they need to get their flu shot?
Yeah, so we deal with children of all ages, from infancy to adolescence, and so it really depends on kind of the age that you're talking about. So for infants, we recommend, making sure that you make eye contact, staying calm yourself, using soothing voices, and after the vaccination, hugging and cuddling as much as possible. For some of the toddler age ranges, they can bring special things that make them feel comfortable, a special blanket or cuddle item, and again, just sort of keeping calm and giving them those hugs and praises afterwards. For older kids, I do recommend talking honestly about the vaccination, making sure that they understand why they're getting it. And you can keep it brief and appropriate for their age, but I think they should know why. The other thing is making sure that we always tell the truth. And so making sure they know that, yes, it might hurt, it might sting a little bit, but that pain is temporary and it will go away. The adolescents tend to do well if you kind of talk about kind of breathing through the pain. And for adolescents, they're more at risk for fainting from lots of injections. And so for those kids, we like them to be rest for about 15 minutes after they get the vaccine to eliminate that. But I always tell parents, let me know what works best for your child. You know what works best for your child, so let us know how we can help.
That's great. So the flu vaccine is available now. And so do you know how can they just come in? Do they need to call for appointment?
Yeah, that's a great question. So there's lots of different options. You can call for an appointment, and we have appointments available all day long. And there are also specific flu clinic days where we'll have appointments through the evening as well.
That's great. All right. Well, thank you, Dr. Amsberry, for all this information about the flu and about getting the flu vaccine. Now, CentraCare offers, as Dr. Amsberry said, many opportunities at your flu shot for your entire family. Everybody can come in just one visit and get it all done. So you can schedule an appointment by calling CentraCare Connect at 320-200-3200 or check out CentraCare.com. We've got listings for walk-in flu shot clinics. So again, thank you so much for this great information.
Absolutely. Thank you.
Have a great day.